DLIVE stands for Detroit Life is Valuable Every Day. It's a violence intervention initiative that's currently based out of Sinai-Grace Hospital. The focus of the initiative is working with young people who've been injured as a result of traumatic violence. Young people, young adults, men and women. These injuries include either being shot, stabbed, or physically assaulted.
I have received a gunshot wound to the face. So as I'm in the hospital, just sitting, surgery, pain.
When I walked into the hospital the day Tyrone was shot, because Tyrone was an identified gang member. When I first seen him, the first thing he said was, "Ray, what you doing here?" And I'm like, "I work here, but why are you here?" It was just me trying to help him. And then he was just like, "Let me see how much he can do."
DLIVE was born out of the need to address the premature injury and death associated with violence. Not only is homicide the #1 cause of death for young people in Detroit ages 15 to 34, but it's also important to remember that for those people who have been injured and not killed as a result of violence, they have a high risk of being re-injured again. As an emergency medicine physician here at Sinai-Grace Hospital, I was seeing the same people come through our trauma doors with similar injuries. It became increasingly clear that there was something that was being left untreated when people were being discharged from the hospital. As a result, it became imperative to look at recurrent violent trauma through a public health lens, much the same way we would look at any other preventable disease process.
We cure violence by changing the mindsets of the individuals that are actively involved in violent activity. So how we change that mindset is by providing them with opportunities that are generally not provided for them. We're going to connect you with the resources in a meaningful, in a real way, so that you can receive the benefits of them.
I can say it could change your life in a way of thinking.
And people talk about violence being sort of like an infectious disease and a contagion, and that has a ripple effect into their social network. Now everybody's, sort of angry and mad, and now, you got this sort of the toxic stress of the violence that's permeating in the community. But if you can stop that and prevent that, now all of a sudden, what that person takes back into the community is something much different and something much more positive.
They're telling them they can change their life around. It don't have to be like this. It can be totally different.
We just have to care, we just have to love them.